The information provided in this podcast is for educational purposes only and should not be taken as medical advice. Before making a health decision, please consult with a qualified medical professional. Thank you for your attention and enjoy today's episode. What is up, cooties and germs of the internet? My name is Tony and you are listening to Hemp Nerd, the podcast that helps you know your cannabis and cannabinoids so you can get reliable therapeutic results. Now, in today's particular episode, we're going to be looking at tennis elbow and figuring out whether CBD oil works for tennis elbow or not. Now, in order for us to do that successfully, we first need to understand the problem that is tennis elbow. So, what is tennis elbow? It is a form of tendinitis that affects the tendons connected to the muscles of your outer forearm. The medical name for tennis elbow, is not tendinitis, is lateral epicondylitis, and I hope I'm pronouncing that correctly. I've most probably butchered it, but that is okay. Now, this is a condition where the tendons joining your outer forearm muscles to your outer elbow become damaged due to overuse, just like tendonitis. This causes pain, tenderness, and inflammation in the early stages. Now, despite the name, only about 5% of people suffering from tennis elbow get it from playing tennis. The remaining 95% of people or so get it from jobs that have repetitive one-sided movements, such as, electricians, carpenters, gardening, and a majority of desk-bound jobs. Now, what causes tennis elbow specifically? So tennis elbow is caused by damage to a specific forearm muscle called, and I hope I say this correctly, the extensor carpi radialis brevis. I hope I say that correctly. Commonly known or abbreviated as the ECRB. Now, the ECRB helps stabilize your wrist when your elbow is straight. When your ECRB is weakened due to overuse, microscopic tears form in your tendon attached to your lateral epicondyle. All right, this is the bony ball-like area of your outer elbow. Microscopic tearing and your body's repair system can lead to macroscopic tearing and structural failure in your ECRB muscle where the condition originated. Now, what are the symptoms of tennis elbow? The dominant symptom of tennis elbow is pain. All right, the dominant symptom of tennis elbow is pain. You're likely to experience pain in the outer area of your elbow, spreading through to the outer forearm down all the way to your wrist. The pain from your outer elbow to your wrist will cause a weakened grip strength, weakened finger extension, and an overall loss of range of motion. Inflammation is only present in the early stages of tennis elbow. So it's not a major concern or a major issue or a major symptom. Pain is. Now, what are the common forms of treatment for tennis elbow? So about 80 to 95% of patients successfully recover from tennis elbow with non-surgical treatment. The most common non-surgical treatment is rest. Plain and simple, resting. Resting your elbow for several weeks at a time from intense activities or from any activity like sports allows your body to repair and heal itself. Now, other forms of treatment include, again, over-the-counter drugs for pain relief and possible inflammation, wearing a brace to limit movement and reduce pain, physical therapy to strengthen your forearm muscles, steroid injections as directed by a medical professional, and surgery as well, followed by rehab from that surgery. Now, the question of the day: does CBD oil work for tennis elbow? Now, based on my research so far, I can confidently say that CBD oil works for tennis elbow, because tennis elbow is mainly dealing with pain while waiting for your tendons and your muscles to repair themselves, or your body to repair itself. Now, details of how it does all this can be found in my previous post or my previous podcast episode where I explore the effectiveness of CBD for tendonitis. Because like I said at the beginning of this episode, tennis elbow is a form of tendonitis. I've written about this and I've also podcasted about this, which were both my first entries into this space. However, what I'm going to do in this particular episode is actually break down the highlights of my findings in this podcast to save you clicking around on the internet to find HempNerd.co and to click onto the blog post titled "Does CBD Work for Tendonitis?" I'm going to break down the highlights and focus more on the tennis elbow aspect of my findings. Of course, you can always go check that content out if you're interested in reading what I found in that article, or just listening to the podcast with the same name, which was my previous entry. Now, in this particular podcast, we've established that tennis elbow is a form of tendinitis that affects the outer area of your elbow, called the lateral epicondyle, and I hope I'm saying that correctly. We've also established that the most dominant symptom of tennis elbow is pain in your outer elbow, outer forearm, and in your wrist. Other symptoms include limited range of motion, which is to be expected because you've injured your elbow, and inflammation in the early stages of tennis elbow. Thus, to establish whether CBD oil works for tennis elbow, we need to confirm whether CBD provides pain relief in joints and muscles. Okay? Now, one of the studies that I previously looked at in my tendinitis blog post and podcast, it was a 2019 fibromyalgia patient study that looked at the impact of CBD on their pain symptoms. Now, the study found that CBD combined with THC provided the best pain relief effects in comparison to a CBD dominant solution, a THC dominant solution, and a placebo. I'll repeat that. The study found that CBD combined with THC provided the best pain relief effects in comparison to a CBD dominant solution, a THC dominant solution, and a placebo. The study concluded that CBD is most effective for pain relief when combined with THC in a 1-to-1 ratio. That's very important information there. I'll repeat that. The study concluded that CBD is most effective for pain relief when combined with THC in a 1-to-1 ratio. Now, if you're unaware, fibromyalgia is a chronic pain syndrome that causes muscle pain, joint pain, and tenderness, amongst a few other symptoms. Now, in another study that I previously looked into for my tendinitis blog posts, and podcast was a 2010 cancer patient study where the cancer patients had advanced cancer pain and they were not getting adequate results from strong opioids. Okay, now this study also found, right, that CBD combined with THC in a 1-to-1 ratio provided the best pain relief results. The solution was compared to a THC dominant solution and a placebo, all right, just to make sure that this is not all just happening in the patient's mind, like this is real. The study concluded that CBD combined with THC in a 1-to-1 ratio provides better pain relief than strong opioids in patients with advanced cancer pain. To me, that's groundbreaking, and we figured this out, or these guys figured it out in 2010, and no one's talking about this. I'll repeat that once more. The study concluded that CBD combined with THC in a 1-to-1 ratio provides better pain relief than strong opioids in patients with advanced cancer pain. Now, if you're unaware, right, cancer can cause pain in your joints, muscles, soft tissue, and bones. And the specific type of cancer that does this is blood cancer, which you may have heard of in the form of leukemia, lymphoma, and myeloma. Now, I didn't want to just leave it just there, right? I was digging around to see if there's another study that kind of reflects or supports these two studies, the findings of these two studies. And lo and behold, I found a 2005 rheumatoid arthritis patient study where a cannabis-based medicine called Sativex was used to measure the effectiveness of cannabis for joint pain relief. Sativex is described as being a blend of whole plant extracts dominated by CBD and THC amongst other cannabinoids. And if I remember correctly from the study, I didn't put this in the blog post, but if I remember correctly from the study, they said the reason they went with CBD and THC as the dominant cannabinoids is because of previous studies where they were looking at conditions that involved pain, and the solutions that provided the best pain relief results in those previous studies that these guys looked at were also where THC and CBD were in a 1-to-1 ratio. So that's why Sativex was developed in this way. Now, the study found that Sativex produced significant pain relief effects in patients compared to a placebo. So it was just Sativex and a placebo. Is this all in the mind or is this real? All right. The patients in the study experienced reduced pain on movement, reduced pain at rest, and an improved quality of sleep. Now, for tennis elbow, reduced pain on movement and reduced pain at rest are significant findings, right? Because tennis elbow, your range of motion is limited, and if you try to extend that range of motion past the point of pain, you experience excruciating pain, to say the least. All right, so reduced pain and movement is more or less a breakthrough for someone who's experiencing tennis elbow, and then reduced pain at rest. So if you're experiencing a lot of pain at rest, let's say you've got a brace, but even if you've got that brace and it's limiting your range of motion, it may not be reducing the amount of pain that you feel due to the amount of damage caused in your elbow. So having reduced pain at rest as well is significant for someone suffering from tennis elbow. I personally believe, of course. Now, the study concluded that a significant pain relief effect was observed, and the disease effects as well for rheumatoid arthritis were suppressed in the patients that took the CBM, that took Sativex. Now, if you're unaware, rheumatoid arthritis is an autoimmune disease that causes joint damage, joint pain, swelling, tenderness, and stiffness throughout the body. What's interesting when they say that it suppressed the disease effects of rheumatoid arthritis, that's interesting to me at least, because rheumatoid arthritis is an autoimmune disease. What does that mean? An autoimmune disease is a disease where your body's immune system actually attacks healthy cells. All right, you can go look that up on Google. So that's really interesting that not only did it provide pain relief, it also suppressed, in my words anyway, it suppressed the advancement of the disease, the advancement of the rheumatoid arthritis. So what are my final thoughts on this? Because I could keep digging up studies for days, but what are my final thoughts on this? So far, my thoughts are that cannabis is a viable and effective form of treatment for pain caused by tennis elbow, amongst other conditions, which we're going to look at in the future. But for now, we're looking at tennis elbow. It is a viable form of treatment. And even though there are no direct studies to point to support this, at least we can look at indirect studies where there are conditions with a symptomatic overlap with tennis elbow to conclude that it is a viable and effective form of treatment. And also, as stated in my previous article, my previous podcast, where I was looking at the effectiveness of CBD for tendonitis, if I were in joint pain and I required relief, and I was looking at a CBM, so a cannabis-based medicine or a cannabis-based product, then I'll be on the hunt for a full spectrum CBD oil solution. So what do I mean when I say full spectrum CBD oil or full spectrum CBD oil solution? This basically means that the entire spectrum of cannabinoids are present in the solution. That's all that means, full spectrum, the entire spectrum, versus, let's say, broad spectrum, which you also find in the market at the moment, where all the cannabinoids except THC are not present. So I'll be after a full spectrum because THC is present. And the reason why THC is important is because 3 studies that I've looked at where they were looking at the effectiveness of cannabis for pain found that CBD combined with THC in a 1-to-1 ratio produced the most effective, most significant pain relief results in cancer patients, fibromyalgia patients, and rheumatoid arthritis patients. That's why I'll be going for it. Now, I'll be going for something as close to a 1-to-1 ratio as possible because of my findings so far, but I think that's going to be a bit challenging because the legal standing at the moment with THC in cannabis-based solutions or CBD oil solutions is that the THC component has to be 0.3% or less for that to be legally sold in the, let's call it the white market, all right? To be legal, basically. Which is a bit of a challenge because if you're dealing with pain, you're looking for something with a 1-to-1 ratio of THC to CBD. So unless, let's say, you go the black market or something of the sort, then it's going to be challenging to find something that's actually going to give you pain relief. Unless maybe, of course, you can get it through your doctor and your doctor actually has access to CBD solutions that have higher THC content in it. in a 1-to-1 ratio with CBD. And I believe Sativex, which is something I found here, is one of those solutions, right? They've got it approved through the approval boards and standards and all this thing, and they can sell it through, the medical system. I don't know what price tag is going to be on it, but if you're dealing with pain, that's something that would work. I mean, if it can work for someone with rheumatoid arthritis, I'm sure it can work for someone with tennis elbow or some form of tendonitis. All right. Now, I personally believe, and this is going a bit off topic, but THC has been misunderstood. All right, just looking at my findings so far, and the deeper I dig into this, the more I find that THC has been misunderstood, and of course has been demonized for all the wrong reasons. Yes, I agree. It can make you high. It can give you a psychoactive effect, but so does alcohol. I mean, people use alcohol for numbing pain, right? That's what they use it for in hospitals or in clinics. They use it to numb pain so they can, I don't know, cut you open or do something that's going to cause pain. So, they give you some form of alcohol to eliminate that. But it also gets you intoxicated. It also damages your liver. And it also causes about 3 million deaths globally. And this is according to the World Health Organization. If you want to check that out, again, I've got that linked in the blog post with the same title as this one. You can just check that out at HempNerd.co. Scroll all the way to the bottom. I always have a reference list, and you'll be able to read what I found in regards to that, which is, again, 3 million deaths caused by alcohol, according to the World Health Organization. However, in contrast, when I'm digging for death data linked to cannabis, there doesn't seem to be anything recorded in human history so far, whereas cannabis causes X amount of deaths. The way I see it, cannabis has not caused a single death, not one. Not one death can be clearly attributed to cannabis. So between the two, between alcohol and cannabis, alcohol needs to be classed as a dangerous narcotic in my eyes, in my personal view. And cannabis needs to be classed as a harmless plant with nearly a limitless amount of benefits and uses. All right. Now, speaking of benefits, going back to the topic at hand here, your best bet for tennis elbow, if you're someone suffering with tennis elbow, you don't want to use over-the-counter medication anymore, and you are actually in the market for CBD oil, I would be looking at full spectrum CBD oil with equivalent amounts of THC and CBD, preferably in a 1-to-1 ratio. Alternatively, if you can get your hands on approved CBM, approved cannabis-based medicines with guidance and clearance from your doctor, then I believe you're good to go in that regard as well. And here's something that pops up as well in my mind. If you've tried CBD oil for pain relief and it didn't work for you in the recent past or the far past, then I strongly believe that there wasn't enough THC in that product that you purchased to help alleviate your pain. I think it was more CBD, less THC, and all the studies have found CBD alone, like if you take either CBD isolate or broad spectrum CBD, is not adequate or not enough to actually relieve pain symptoms. That's what the data or the studies are showing me so far. So I would stay on the hunt and be more diligent with knowing how much CBD and THC are in the product. Of course, the challenge is that you've got that 0.3% THC legal limit in your bottle, but I don't know, maybe you might need to go to the black market for that. I'm not a doctor. Don't take my word for it. Consult a doctor. If your doctor is not pro-cannabis, then find a pro-cannabis doctor and have a word with them. They could have something like Sativex in the back, and they might need your signature in order for them to dispense that or write that script up for you. But talk to your doctor. Use common sense there, okay? Just because I'm researching and finding these answers doesn't mean I'm your doctor. Now, I hope this podcast was actually helpful. I hope it actually cleared up a lot of questions that you may have had regarding, let's say, tendinitis, but more specifically, tennis elbow, and whether CBD oil works for it or not. Again, I'll say it does work, and it does work the best if it's combined with THC in a 1-to-1 ratio. Like, I want to drive that home, so next time when you're dealing with pain, that's what you need to actually look for. Thank you for listening. If you want to check out all the studies that I have mentioned in this particular episode, previous episodes and episodes to come, please visit HempNerd.co. At the end of every blog post, I have a reference list of all the different studies or trials that I looked into to produce this content, to bring it out to you so you can, it's digestible for you. Because sometimes it does, hurt my brain to read some of this stuff. But then that's what I guess being a hemp nerd is all about. Like, I have to actually hurt my brain a bit to learn the truth so I can bring it to the surface for you to consume and make more intelligent purchasing decisions, so you can get so you can know your cannabis, know your cannabinoids, and get reliable therapeutic results moving forward into the perpetual future. Like, if this is what it takes, then so be it. I'm in it for the long haul. So remember, HempNerd.co. You find all the links there if you want to nerd out on some of these studies. Let me know if there's something I've missed. Let me know if there's a question that you want me to cover in future episodes. Otherwise, for now, take care, God bless, and I'll catch you on the next episode. Peace.